Good morning. Throughout this pandemic, I've encouraged everyone to stay the course. When a contagious, dangerous virus spreads through a community, no one can be the exception to responsible action. Throughout this pandemic, we've seen the number of cases ebb and flow, and we are again seeing a concerning increase in cases. As of today, we're averaging 189 new cases per day, which is a 30% increase in cases over the previous week. This new threshold puts us back into the CDC's high category of transmission, and it seems to be accelerating. The positivity rate is up for the first time in a couple of months. Our public health experts and partners in the region's healthcare systems tell us this increase appears to be across the board, not limited to any age or geography. However, our 5 to 14-year-olds continue to have the highest infection rate, making efforts to vaccinate these children even more important. Because we're not seeing sharp increases in-school transmission of the virus, we know that COVID is largely spreading outside of the classroom. The prevalent attitude that COVID is over needs to change. We must redouble our efforts to get vaccinated, to wear a mask in public, and to protect everyone around us. Public health experts tell us these continued increases in numbers represent what is likely the beginning of a winter surge. More indoor gatherings are around the corner as the holiday season begins. Such gatherings can increase the risk of spread, so increased vaccination is critical. This includes boosters. In St. Louis County, more than 1.2 million doses of COVID-19 vaccines have been administered, averaging just over 3,700 doses per day. Boosters and children's vaccines are where we're seeing the largest numbers. People receiving booster doses outnumber people beginning the primary series 2 to 1. In St. Louis County, 54.5% of our residents are fully vaccinated. Those receiving at least a first dose is now more than 61%. But there is still great disparity based on zip code. For example, 76.1% of residents in Maplewood have had at least one dose, as have those who live in 63017, which includes parts of Chesterfield, in Town and Country. By comparison, only 40.1% of those living in 63133 zip code have started the vaccination process. That includes the communities of Wellston, Pagedale, and Hanley Hills. As I said before, stay the course. With each passing day, more shots in arms means more protection in place for all of us. And I know it's hard to tune out the noise of social media and the 24-hour news channels where anti-vaxxers share their dangerous misinformation. And I've heard plenty of it myself over the past several months at county council meetings, where a mask mandate is flouted and dark web quackery is quoted like it's gospel. Talk to your doctor, talk to your pastor, talk to grandparents who are looking forward to seeing their grandchildren at Thanksgiving. And kids, listen to Big Bird. Sesame Street has long been a place to educate and entertain children. While a Texas senator seems to be threatened by the beloved family character, the message that a vaccine will keep children healthy is not propaganda, folks. It's fact. Vaccines are safe and effective. They've allowed our children to learn in the classroom, workers to get back to their offices, and restaurants to operate at full capacity. Let's not let a winter surge derail the long and responsible journey for so many. Get vaccinated, continue to wear a mask, and if you have any symptoms or have known exposure to a COVID case, please get tested. If you test positive, please isolate yourself so that you limit transmission. So many of you are doing the right thing. Thank you. It's your responsible actions that prevented this pandemic from being much worse. And I'd be happy to take any questions.
Dr. Pitts, what do you think is behind the increase? We've been talking about cases generally on the decline for quite some time, and now we have cases on the rise, at least at this point. What's your thought about what's causing it?
So the question is about the increase and why is it, why are we seeing it? I think it's several things. Most of the cases are increasing from household contacts. So someone in the house is bringing it home and passing it along to other people who live in the same household. With more people gathering inside and a little bit of sentiment in the community that we're through this, I think people are dropping their guard a little bit. And we need to continue the efforts to keep our masks on, and we need to continue our efforts to get people vaccinated. There is some concern in the community that some of the vaccination immunity might be fading a little bit because people are ready for their booster. And even though you've been vaccinated and you're likely to be protected from serious illness, you can still test positive for COVID and pass it on to someone else. And that's why if you're due for a booster, you should get it.
How worried are you about the potential for a winter surge, given the increase we're seeing now?
Well, I'm worried when my public health experts tell me to be worried, and when the pandemic task force leaders tell me that we should be worried. And right now, they're telling us that across the country and here in the St. Louis region, we're seeing cases tick up, and we need to keep up our guard. Any other questions?
Dr. Page, we have,
Go ahead.
do you have more?
No, go ahead.
Okay. Public radio has questions about the infrastructure bill.
Okay.
Are you in discussions about what the county could use that money from the federal infrastructure bill for? What are some things that we're considering?
Yeah, so the question is about the federal infrastructure bill. We're very excited. That was a big win for our community when that infrastructure bill passed last week. We know that we have over $200 million worth of unmet needs in fixing our roads in the community, and we're very excited about, for the first time in a long time, having funds to improve our arterial roads in St. Louis County. We know that some of our county buildings are in need of repair, and there's been serious deferred maintenance for the past 10 years because we just haven't had the money. In addition, we're partnering with the City of St. Louis to study the possibility of expansion of Metrolink line, and we'll be talking about that as well.
That's all I have. Anything else?
Okay,
Okay,
thank you.